vaccinations for blood-borne pathogens. We'll start with the most obvious, the hepatitis B vaccine. In 1983, an estimated 17,000 hepatitis B infections occurred among healthcare professionals. In contrast, in 2001, approximately 400 healthcare professionals became infected with hepatitis B. This significant decline was largely due to the widespread immunization of healthcare professionals with hepatitis B vaccine, the use of standard precautions, and other OSHA requirements. Vaccines to prevent HBV became available in 1981 and were recommended for healthcare professionals in 1982. Although a national strategy to eliminate HBV was implemented in 1991, and newly reported HBV infections have decreased by 89%, an estimated 850,000 to as many as 2.2 million individuals are currently living with chronic HBV, and these individuals serve as the main source of HBV today. The hepatitis B vaccine works by causing your body to produce antibodies against HBV. The vaccine does not contain any human blood or blood products. It's effective in greater than 90% of adults. A federal standard issued in 1991 under OSHA mandates that the hepatitis B vaccine be made available at no cost within 10 days of initial assignment. However, after required blood-borne pathogens training to all employees who are exposed occupationally to blood or other potentially infectious material. As a reminder, occupational exposure is defined as reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious material that may result in the performance of an employee's duties. Hepatitis B vaccine is a series of 3 intramuscular shots at 0, 1, and 6 months. If shots 2 and 3 are delayed, the series does not need to be restarted. The most frequently reported side effects are soreness at the site and a mild temperature. Revaccination is not associated with an increase in side effects. Hepatitis B vaccine is contraindicated in persons with a hypersensitivity to yeast or any vaccine component. Persons with moderate to severe illness should wait to receive the vaccine until their illness resolves. The vaccine is not contraindicated in persons with multiple sclerosis, autoimmune diseases, Guillain-Barré syndrome, or other chronic diseases. Please check with current CDC guidelines regarding vaccinating a pregnant healthcare employee. Additional recommendations for healthcare employees. Although some of these are not relevant to the healthcare employee population, they are included in this training in an attempt to be complete. All identified at-risk employees should receive the full hepatitis B vaccine series. Historically, pre-vaccination serologic testing was not indicated in employees being vaccinated because of occupational risk. However, the CDC recommends certain groups undergo testing for HBV infection. These include hemodialysis patients, pregnant women, persons known or suspected to have HBV exposure, some foreign-born persons, and HIV-positive persons. Employees with an incomplete series of hepatitis B vaccine are not considered protected. Because a higher risk is reported during training, vaccine should be given before contact with blood, preferably during school. Post-vaccination serologic testing should be performed 1 to 2 months after the last vaccine. Healthcare and public safety employees at high risk for continued percutaneous or mucosal exposure to blood or body fluids should be tested. Persons determined to not have adequate hepatitis B surface antibodies should repeat the full series or 3 vaccines and have serologic testing to recheck immunity status. Suboptimal response to the vaccine might be more likely in the following groups of individuals: over 50 years of age, if you received the vaccine in the buttocks, if you're HIV positive, or if you're a hemodialysis patient. Serologic testing should always be performed on any person that has an exposure. Hepatitis B vaccine provides immunologic memory, which provides long-term protection. At the present time, only very high-risk populations are advised to receive boosters, such as those undergoing hemodialysis and other immunocompromised patients. The map indicates by color which states have the largest percentage of people living with hepatitis B, white being the least and darkest blue being the most. Hepatitis B vaccine declination form. This must be signed by an employee who has been classified as occupationally at risk and chooses not to accept the vaccine. This can only be signed after appropriate training regarding hepatitis B, the hepatitis B vaccine, the safety of the vaccine, the benefits of the vaccine, and that it is offered at no cost to the employee. Employees can request and receive the hepatitis B vaccine at a later date if they remain occupationally at risk for hepatitis B. If an employee has already received any portion or the full series of the hepatitis B vaccine series, they should provide documentation or be tested for immunity. Hepatitis B treatment. Acute hepatitis B has no medication available and treatment is supportive only. This includes rest, adequate nutrition, and fluids. Chronic hepatitis B treatment includes the following: antiviral medication, which fights the virus and slows its ability to damage the liver. Interferon, a synthetic version of a substance produced by the body to fight infection. Liver transplant. This would occur in very severe cases of chronic hepatitis B. And regular monitoring to assess liver damage. Currently, there is no vaccination available for hepatitis C. Acute hepatitis C is a short-term illness that occurs within 6 months of exposure. However, 75% to 85% of those infected with hepatitis C will develop a chronic infection. In an attempt to prevent acute illness from becoming chronic, acute hepatitis is treated primarily the same way as chronic hepatitis C. The optimal start time remains uncertain. In 2011, treatment for hepatitis C was introduced. This originally consisted of highly effective protease inhibitor therapy. Recent advances in the number of medications to treat hepatitis C have changed the outlook on hepatitis C. The medications have shorter treatment regimens, are easier to tolerate, and are more effective. Currently, there are 11 different FDA-approved hepatitis C medications. That number, however, is always changing. Currently, there is no vaccination for HIV or AIDS. HIV is treated with a combination of medications to fight the infection. This is called antiretroviral therapy, or ART. This is not a cure. This treatment involves taking medicines that prevent the virus from multiplying. Having less HIV in your body gives your immune system a chance to recover and fight infections and cancers. This also makes it less likely to transmit the virus to others. Many advances have been made in recent years for the treatment of both hepatitis C and HIV. However, following all of the recommendations, including standard precautions each and every day, is critical in protecting yourself, as both of these bloodborne pathogens remain a risk to healthcare employees.